Welcome back to East Texas Live here on KETK. You know, Halloween, it started with the fun-size candy bars.
Oh, fun size, but way too many.
Oh, yeah, way too many of those. Then, of course, you got Thanksgiving, then we got Christmas dinner, then we got New Year's Eve and all the parties and all the Christmas parties, too. Man.
Yeah, it's probably
tough.
it's not the healthiest for the heart or the waistline. No. Have no fear, though. Dr. Pitonak from Trinity Clinic Cardiologist joins us in the living room to tell us how to try and be heart healthy over the holidays.
Nice to have you here, Doctor.
Welcome.
Good morning. Thank you for having me.
An awful lot of temptations. What are some good tips on staying heart healthy this time of year?
It is a difficult time of the year because everybody, even whoever is on a diet and exercises during the time of the holidays, we want to treat ourselves. So usually try to eat things that we're not supposed to. But the main thing is just, as you said, stay active and maybe even more active during the holidays because we tend to eat more. And the fat is the really part of it, and salt. So low fat diet and low salt diet. And even if you treat yourself, just use smaller portions so you decrease the amount of calories of you have.
Moderation, the key here, Doctor.
That is the main thing.
Now, I've heard some myths about this. Not sure, maybe you can set us straight. Are there more heart attacks during the holiday season, perhaps?
There is a trend in the month of December or during the winter time where we have more patients in the hospitals. It is true. What is behind that? Very difficult to tell, but it's very likely more stress because it is a stressful part of the year, plus the mistakes in the diet as well. Mainly patients who already have congestive heart failure, they tend to eat more salt, which salt binds the fluid, and they get volume overloaded and actually end up in the hospital at times with a volume overload and heart failure.
Figure the heart attacks would come about January when we get the credit card bill for Christmas.
Right.
But no.
Yeah, too.
Now, quickly, some typical signs of that you are having a heart attack. Now, I the one about the arm hurting or turning numb, that's the big one, right?
It is a part of it, but it's really the typical described pain is, and patients even don't describe it as a pain. It's more discomfort. It's a pressure type feeling on the chest, as if somebody was squeezing your chest or pushing you from inside, sometimes associated with nausea, sweating, some people vomit. Those are typical symptoms. It can radiate to your arm, can radiate to the chin. Not always, though.
To the chin, I'll be darned.
You're right, yes, or neck and chin.
And technology is constantly changing all the time. Have there been any recent breakthroughs in heart health and cardiovascular health?
Well, the cardiology is a very dynamic part of the medicine, and the advances for the last at least 10 years or so are amazing. What we can do now with when already somebody has a disease. So we have a lot of advances there. We also, everybody notices that we just don't do the right thing. So as you said, the prevention is really important part of the medicine and cardiology. But as advances, I would just mention that we can do procedures that can fix or open up the vessels in the heart. Actually, even nowadays, exchange the valve through the catheter, so you don't have to have an open heart surgery in some cases in high-risk patients.
Oh, wow.
So there are many things that we can do now that we couldn't do in the past.
It's amazing. Okay, so what I got from this: moderation, low sodium, which sodium always tastes so good, salt on everything, and low fat. But moderation is key.
And no smoking too.
No smoking.
You're taking all the fun out of the holidays, aren't you, Doctor? Doctor, always nice to see. If you want to get more information, you can staying heart healthy, tmfhc.org. And again, thank you for coming by, and happy holidays to you.
Thank you very much.
Thank you.